In this video, we're going to look at the vascular supply of the eyeball. We will start with the ophthalmic artery and then quickly run through the veins. So I want to start here because orientation is everything really. If you look at the lateral view of the skull and remove the frontal and the zygomatic bone, we will be able to see the ethmoidal bone and the optic canal from which the ophthalmic artery comes from. Now, I want you to take a mental picture of this specific area because I've simplified it in order to map the artery easier. So the ethmoidal bone and the optic canal is here, and for orientation's sake, the lacrimal gland is here on the upper lateral region of each orbit. Now, the ophthalmic artery comes out through the optic canal and stays on the medial side of each eye. Now for the branches, I like to use Dr. McLessie as a mnemonic. Arranging them like this, our first side branch is the dorsal nasal. I kind of slip off the tongue here saying that it's a side branch. The dorsal nasal is more of a terminal branch of the ophthalmic artery. It goes out at the medial corner of each eye, and then it will communicate with the angular artery. And do you remember which artery the angular artery comes from? It's the facial artery from the external carotid. Good job if you got this one right. So that's this one. Next is the R for central retinal artery. It pierces the eyeball together with the optic nerve, and then it branches off, supplying the retina. So remember the layers of the eye. There is first the sclera, and then the choroid, and then the retina. So as you see here, the artery branches out specifically to the retina. That's this one. Next is the M for muscular branch, supplying the external muscles of the eye. So remember, you got 4 rectus muscles or straight muscles and 2 oblique muscles, one on the top and one on the bottom. The artery will supply all of them, and then it will give off an important branch called the anterior ciliary artery, which form a vascular zone under the conjunctiva of the eye. And it doesn't really do that alone. The posterior ciliary artery will pierce the eyeball from the posterior side and contribute to the vascular supply of the eyeball. So I want to spend a minute to tell you a little bit more about this circle because it's really important. So again, here's the 3 layers of the eyeball: the sclera, the choroid, and the retina. Up here we have the conjunctival membrane, which is a mucosal membrane covering the sclera. And then there's the cornea covering the anterior side of the eye, with the iris here and the lens, and of course the ciliary body and the suspensory ligaments. So that's the general anatomy of the eyeball. But essentially from the extraocular muscles, remember the anterior ciliary artery, which comes from the muscular branch of the ophthalmic artery, it goes out to then supply the conjunctiva, contributing to a vascular zone of the conjunctiva. And you see this a lot. Those are the superficial vessels between the conjunctiva and the sclera. You see grossly on the eye, as you see here. But the anterior ciliary also has branches to the major arterial circle of the iris. And remember, I just mentioned the posterior ciliary arteries. Both the short and long posterior ciliary arteries, they lie in the choroid part of the wall of the eye. The long one will help contribute to this circle, and the short ones will form a small arterial circle called the intramuscular arterial circle. So zooming into this specific area, this is how it really looks like, supplying basically the structures of the eye, like the iris, the ciliary body, the choroid, etc. I will eventually mention this later in this video again when I talk about the veins, because there's going to be veins here as well. So that's these 2. Next is the L for lacrimal artery, supplying the lacrimal gland. It do have one important side branch called the lateral palpebral artery, supplying the lateral part of the eyelid. Next, E for ethmoidal arteries. There's the anterior and the posterior ones. They run through the ethmoidal foramen, as you see here, and then they will both eventually end up in the nasal cavity. But the anterior ethmoidal will first run through the anterior cranial fossa to then supply the anterior meninges. Then it will go down through the cribriform plates that's the plate of the ethmoidal bone, to meet up with the posterior ethmoidal artery supplying the nasal cavity. So what's interesting here is that they contribute to form a plexus of arteries in the septum of the nose called the Kisselbach's area or Little's area. And this is the area that you usually rupture when you nosebleed. It is formed by the greater palatine and the sphenopalatine of the maxillary artery, and the superior labial of the facial artery, and the ethmoidal arteries of the ophthalmic. So that's these. Next, the supraorbital artery, which goes upwards through the supraorbital fissure. It supplies the skin and muscles of the forehead and anastomose with the frontal branch of the superficial temporal artery, remember? And then we got one similar called the supratrochlear artery, which also passes upwards, but this time through the frontal foramen, which is a little medial to the supraorbital fissure. The supratrochlear artery will also supply the skin and muscles of the forehead. The last letter I stands for the internal or medial palpebral artery, which goes out on the medial side of the eye, forming a superior and inferior palpebral arch together with the lateral palpebral artery, supplying the eyelids, as you see here in this picture. So that's mainly it for the ophthalmic artery. Now let's quickly go through the veins. The venous drainage happens with the help of the superior and the inferior ophthalmic vein, draining into the cavernous sinus. From the superior ophthalmic vein comes the central retinal vein, going together with the central retinal artery to drain the retina from blood, as you see here. Then there's the vorticose veins, and these are really important. There is 2 on the superior side and 2 on the inferior side. Now remember earlier that I showed you this scheme of the ciliary arteries making up the major and the minor arterial circle. The varicose veins, they will contribute to this, to drain most structures of the eyeball. So these are really important. Now essentially both the superior and the inferior ophthalmic vein drain from the angular vein, which comes from the facial vein. The superior drains from it as the nasofrontal vein, but the inferior will divide into 2 branches. One branch will join the pterygoid plexus through the inferior orbital fissure, while the other branch will connect with the superior ophthalmic vein. So that's a brief look into the vascular supply of the eyeball. I really hope you found this video helpful. Until next time.